Welcome to Beauty Abroad International. Today we're going to be continuing our post-op complications series on infections. In our previous video, we discussed how to prevent infections, and today's focus is going to be on things to look out for and how to monitor for potential infections so that you can let your surgeon know as soon as you start suspecting something, and that way proper interventions can be taken early. So stay tuned. When it comes to monitoring for infections, there's really no one better qualified than you, believe it or not. Because not only are you able to visualize and look at your incisions on a daily and more continuous basis, but you also are the only one that knows how you feel. So if you start feeling off or start feeling under the weather, those are early signs that something may be going on. And so I'm going to give you these tips and pointers so that you have the knowledge and the skill set to recognize when something might be going wrong. But in the end, if you ever have any worries or any concerns, always bring it up to your surgeon, because it's better to call them out on a false alarm than to not want to bother them or not want to say anything, and then it can turn into something actually really serious that can be hard to treat. So the first thing you want to look out for, and this is one of those early signs where it could be nothing or it could be the start of something, but these are the reasons why we monitor, right? So that we can notice a progression in symptoms. So initially, you might have some redness, some swelling, and some warmth around the incision site, and that's all very normal. There's no reason to panic. But if you start noticing that it's getting more red, or that the redness is spreading, or you start noticing that the warmth is starting to feel a little bit hot, or the warmth is increasing, then that could potentially be a sign that infection is starting to brew. And so it's always a good idea to just bring it up to your surgeon and or send them a picture so that they can take a look and just keep an eye on it for you to make sure that it's not turning into an infection.
So just a quick tip, if you do have an incision with a reddened area around it that you feel is starting to spread, is to grab a Sharpie or any kind of marker and just outline the outer edge of it so that we can keep a closer eye on how quickly it's spreading or if it's getting any worse, because that's a good indicator for us whether or not the antibiotics are actually helping. So just a little pro tip for you guys.
Alright guys, so just really quickly I wanted to give you guys a visual of what I was talking about. So let's say that this is a tummy tuck incision and you start noticing some redness around the incision like that. So what you want to do is grab a Sharpie or a marker and you just want to outline the area that's reddened like that so that you can keep an eye on how much better or worse it may be getting. So let's say now that it's the next morning and you notice that the redness is now worse and now it's actually outside of the line like this, right? So this would be a good indicator that whatever antibiotics or treatment plans that they have you on is not effective and that you either need a different antibiotic, something stronger perhaps, or another antibiotic on top of it, or that you may just need another day or so just to see. Now the goal is to have the redness begin to shrink. So if you got up the next day and you did notice an increase in redness, then what you would do is, again, you would just outline the area that's reddened, and that way you can kind of monitor the progression of this redness, right? So if again you start noticing it's increasing, then that may be a sign that the infection is continuing to grow and getting worse. If you do notice that the redness is starting to retract and now it's on the inside of the line and it starts clearing up, then that's a good indicator that the antibiotics and treatments that you're currently on are working effectively. So just a little diagram to give you guys a visual of what I was talking about. Hope that was helpful. The second thing you want to monitor is the drainage coming out of the incisions or out of the drains that you may have in place. So you're of course going to have some drainage, and that's perfectly normal. The drainage at first will look very bloody and red, and it should start to lighten as the days progress and become more watery and more pinkish in color, but it should always remain clear and should be pretty much odorless. But if you start to notice that the drainage is getting milky or looking kind of pussy, or if it starts to smell odd or smell bad, that's a sign that you have an infection going on, and that's definitely something you want to bring up to your surgeon as soon as possible so that they can put you on antibiotics if you're not on any, or if you are on antibiotics, infections can still happen if the bacteria growing is not affected by the antibiotics that you're currently on, and so they may just need to switch up the antibiotics so that it could kill off whatever is going on there. So no need to panic. It's really just about open communication with your surgeon and bringing up concerns early, because early is key. Now, one thing I want to point out is that if any of your procedures included liposuction and you have a drain in place, it is actually very normal to see fat coming through into the drain. And so sometimes people confuse that with pus, but if you're not sure what it might be, always err on the side of caution and just take a picture, send it to your doctor, let them take a look at it, and that way you can make sure that there's nothing bad going on. The third thing you want to monitor for is fevers. So initially, the first few days after your surgery, it is normal, very normal, to have a low-grade fever, anything in the 99 range. But if you have or start experiencing any fevers around 101 or higher, it is very important that you let your surgeon know as soon as possible, because fevers are actually a late sign of infection. By the time your body develops a fever, it usually means that the infection has had time to settle in. And so it's really important that you get put on antibiotics or whatever other interventions are needed in order to clear that up immediately. Alright, so just to recap, the things you want to look out for when it comes to monitoring for potential infections are: number 1, increased redness, swelling, or warmth to the incision sites. Number 2, any drainage that starts becoming milky or smelly. And number 3, any fevers that start to develop, typically anything over 101. As always, remember that if you have any questions or concerns, always just ask your doctor. It doesn't hurt to over communicate than to not and make assumptions that everything's going to be okay or that it's going to go away on its own, and then it could potentially turn into something very dangerous. So just like any of these potential complications, early intervention and catching it early is really key, so that something can be an inconvenience as opposed to something detrimental. So in the next video of our series, we'll be talking about interventions if you do develop a postoperative infection. So stay tuned for that. And as we say at Beauty Abroad, it's your beauty magnified. Take care.